Hi, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan, and I continue through the COVID pandemic to ask some complex questions. As you can see from the image here, depending on your own personal perspective, will determine what you think. Is there a link between COVID blank and cancer? Some people would say COVID weight gain. Some people would say COVID infection. Some people would say COVID lockdown. Very often, they leave out another piece of the puzzle, which is the elephant in the room. I'm not here to tell you what the answer is, but I'm here to give you a history lesson with regards to what happened with smoking. I really am thinking all the time as ways to try and explain to people what it is that needs to be done. How do we utilize the history and the science to be able to clarify answers? Now, if you are interested, coming up, or what I have created, this is easily a few months ago, was the cancer explosion, why I expected it. And I put together a whole course on that. And if you're interested, there is a link with a discount below for while you are seeing this. And essentially, I made a number of straightforward points about the multiple layers of cancer protection, the basis of cancer itself, and critically, I put together this here slide about the number of cancer patients receiving a first treatment. I'm going to come back to this because this is really, really important. So let's step back a minute. And as I said, if you're interested for the course, look at the link below. It's been extended and you can join us. So back to this question about the historical link between smoking and cancer and what happens. Really a fascinating piece of history. So I've got here a paper, and this was looking over 160 years, the historical perspectives of the causation of lung cancer. And they were looking at what occurred, lung cancer being the leading cause of death. And they searched the literature for about 160 years to look at the trends that occurred across the world. And you have to remember that currently, in terms of cancer across the world, lung cancer is still having only a 15% 5 year survival rate. So it is still a serious condition. And it has been linked with regards to smoking. But what's really interesting is how the tobacco industry handled those questions. And I'll show you here what happened at that time. So it showed you here the tobacco industry's role in lung cancer causation theory, late 1800s to 1950. And so they'd been looking at this for a while. And the tobacco industry really, and it shows you here, that when it was strongly linked in the 1940s and 50s, you see up here, 1940s and 50s, um, tobacco industry fights back. So there are a number of breakthrough studies on the hazards of cigarette smoking that were published in the early 1950s. So the tobacco companies joined forces to fight the impact that such reports would have on their customers. They publicly denied the research findings and then established the Tobacco Industry Research Commission to fund unbiased research to continue to promote the safety of their product via strategic public relations campaigns to cast doubt on any future anti tobacco research. Wow. I mean, when I read that, I thought to myself, wow, isn't that incredible? History could be repeating itself. Now, for anyone who has been following me, I always make reference to an elephant in the room. And the reason I have to do that is because there is a significant pushback with regards to censorship and the fact that this cannot be considered to be part of the problem. And as I said, depending on your perspective, will determine what you think is that elephant in the room. We have to still talk in this kind of way, and that's very sad, but it highlights how far we are away from objective science. And this is why sometimes I go back to history to try and make sense. So, here is the reality for those people who don't quite understand what's going on. There is some important information. So, I have got here a chart, and this is from the UK. And this is looking at cancer wasting times 31 days standard. And they are looking, this is from 2020, January 2020, all the way out to December 2023. Now, it's important to note this. Now, this is not an increase, and there's a reason why I'm highlighting this. But what we see here is a general trend over that period of time. And it appears as though it's not really shifting much. But I took the time to break it down. And when I broke it down, and this is part of the course that I was explaining, I'll show you what I showed from that data, is that it looks like this. And I broke it down up to 8 months because at the time I only had data up till August 2023. And in each year, 2020, 21, 22, 23, you can see this is 2020, this is 2021, this is 2022, this is 2023. So the dark blue line represented 2023, the number of cancer patients receiving first treatment. Now, I'll explain that in a minute. But if you notice all the way along, except for this point and slightly here, 2023 was higher than all the other years. And there seemed to be an upward trend month on month, August to January, January to August in each year. And it's no surprise that after I put together this course, and this is why I said that I don't want to take full credit for this, but it seems as though since I did that, there was a change in statistics. Now, it may be completely coincidental, but again, you can hear this is the same data I used. This is from January 2020 all the way through, and this is up until August. Then in September, in October, and I'll make this bigger so that you can see it. I'll just shorten the time right down. So here we have in September, then in August, in October, they changed the metrics. So instead of it being the first, it became first and subsequent. And suddenly then you can't follow the trend. So this is the dark blue. And so I can't see the trend beyond September 2023. Why is this relevant? You have to understand there's a lot of people talk about cancer deaths, but people don't usually die from cancer quickly. And so you have to therefore not look at deaths, but look at diagnosis and referral for cancer. That's where the answers actually lie with regards to the trend. So you have to be careful when people bring up data and say, well, cancer deaths haven't necessarily increased that much. They haven't increased yet, but if you wait, they will suddenly surge 3 to 5 years down the line when a lot of people are dying from cancer. What we have to look at is the diagnosis. When are people being diagnosed with regards to cancer? So, this is a critical point that we have to try and understand. So, again, going back to the point as to how the tobacco industry utilized their systems to, I guess, cover the statistics. What they then did was that they targeted doctors. When the cigarette companies used doctors to push smoking, really interesting. This is from the history point of view. And so this is an image taken at that time. This is a doctor smoking. And the actual image is a bit down here. And so the headline was, "More doctors smoke camels than any other cigarette." So this was the approach that was then used by the tobacco industry in the 50s to clarify or challenge the science that anyone was making. And then in 1950s, when the big study came out, they then took the big step here, and this is now Well, actually, before I show you that, I'll show you this here. So, in the mid 1950s, when tobacco companies had to confront good evidence that their products cause lung cancer, advertising strategies started to shift. What happens is all the different cigarette companies kind of work together to try and promote the idea that we don't know yet if it's harmful. So that's what they would say. And they then published the statement. So this is the statement that was published in the 50s, a frank statement to cigarette smokers, talking about the fact that a study had shown that mice got cancer through cigarette smoking. So here is how they challenged it. They had distinguished authorities point out the medical research of recent years indicates many possible causes of lung cancer. You would hear exactly the same thing today, I suspect. That there is no agreement among the authorities regarding what the cause is. Wow. And again, I tell you, this is the point. People will say, well, even if cancer is rising now, it doesn't mean that it's related to whatever. The point is that usually the people who are saying that are not actually interested in finding the cause. They are interested in identifying that it is not what they are concerned about. So what you hear is, I don't know what the cause is, but I know it's not this. Now, that sounds very similar to what happened then. So let's continue. There is no proof that cigarette smoking is one of the causes of lung cancer. And the statistics purporting to link cigarette smoking with the disease could apply with equal force to any of the many other aspects of modern life. So, this is what, and then they said, we believe that products we make are not injurious to health. I mean, talk about the fact that history can repeat itself. This it's just remarkable. So I thought I had to share this because these are times when you need thinkers, people who can think, who can analyze, who can reflect on the information that is put in front of them. Remember, I'm not telling you what the answer is. I'm just telling you that whichever way we take it, numbers seem to be rising and nobody seems to be interested in identifying the cause. They're just happy to say what it is not, but have no idea what it is, and more critically, have no incentive to try and find the answer. When you hear those people speaking, when you hear those people sharing information, it may not be wise to listen to them because they are probably working for the industry, similarly to what happened with regards to the smoking lobby. They got lots of experts to refute the claims that there were any links. And you have to remember that smoking was only taken seriously in terms of trying to actively reduce it in the 1980s. Can you imagine that? So their push in the 1950s had an impact for over 30 years. Lessons to be learned. So, as I said before, if you're interested to learn a bit more with regards to my perspectives on it, where I cover different angles and I deal with the elephant in the room, please click on the link below. And otherwise, listen out for more presentations as I continue to reflect on important points that hopefully give clarity to people in these challenging times of science when the only people who are affected most are the patients. We need more advocates. We need more people who are searching for answers. And we will continue to make sure that you're kept up to date and informed. Have a great evening.